Welcome to the Health Update. I'm Madison Kasper. With me is Dr. Aarti Raja, Mako Media Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison.
Our topic today is antibiotic resistance. Dr. Raja, what is antibiotic resistance?
Antibiotic resistance refers to microorganisms and very specifically bacteria that are resistant to the drugs or the antibiotics that are often used to combat the microorganisms. And when we refer to antibiotic resistance, so we're talking about the bacteria that have become resistant to the antibiotics. And sometimes it's also referred to in terms of the diseases that these bacteria cause. They're drug resistant and they end up causing certain diseases. So the word antibiotic resistance kind of encompasses both these things.
What is the biggest mistake people make when using antibiotics?
Absolutely. So one of the biggest mistakes is people take antibiotics for a few days and then they start to feel a little better. And so they think, oh, I'm feeling better, I'm going to stop taking my antibiotics. And that's one of the biggest mistakes, is that because when a physician prescribes antibiotics to you, if they tell you that you must take this for 5 days or 7 days or 10 days, you should take it for those 5 days, 7 days, or 10 days, whatever they're prescribing, regardless of how you feel on day 3 or day 4. You have to finish the whole course of the prescription. That's one. And the second big problem with using antibiotics is people sometimes use it for the wrong reason. For example, you should only use antibiotics for an infection that is caused by a bacterium or bacteria. There's no point in taking antibiotics if you have a viral infection. But oftentimes people don't know the difference, or they're unsure, or a physician may not check, is it bacteria, is it virus, and the patient's really feeling very sick, they just want to get some medication and they end up taking an antibiotic. And that's usually not correct, because if you're taking antibiotics and you have a viral infection, it's really not going to do any good for you. However, you may end up causing drug-resistant bacteria to kind of show up.
So looking ahead, what steps need to be taken to either slow down or reverse antibiotic resistance?
Yes, absolutely. So steps have to be taken, and again, multi-pronged approach has to be used. So we have to change how we practice medicine to some degree. So physicians will become more careful about prescribing antibiotics. As consumers, as patients, we have to change how we do things. We shouldn't be asking for antibiotics up front. We should become more educated about it. If we are getting antibiotics, we should take the entire prescription, not just stop halfway, not share antibiotics with our family and friends. So we as consumers have to make a change. There's a lot of change coming in the agricultural industry as well, where they're beginning to change how they give antibiotics. Do they not give antibiotics to the livestock? How do they better take care of their livestock? And also environmental changes are happening. Regulations, laws are changing, so that we all together change the practice of using these antibiotics that are currently available.
How is this directly affecting college students?
Oh, absolutely. It affects college students just simply because we're part of the population, and we're probably getting sick while we're in college or around other sick people, and we end up taking antibiotics or misusing antibiotics because perhaps we're unaware about it. And that just kind of perpetuates the problem. Maybe we are seeing antibiotic drug-resistant bacteria in these populations, and we're in a place where we can easily move these bacteria around, because if a college student gets sick, you're around a lot of other students as well, and suddenly now many more people can get sick. So the problem can spread very easily. So it becomes important for college students to also be aware that this problem exists, and it's not just a problem in this country, it's actually a global problem. So it is something that everyone should be thinking about.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.